Welcome everyone. We'll go ahead and get started with our webinar this afternoon, the Collaborative Research Center for American Indian Health, Writing a Pilot Grant. Thank you for joining us for the second webinar in the series of webinars that we're doing with our pilot grant project. This webinar is part of the Collaborative Research Center for American Indian Health, also known as CRCAIH. My name is Emily Whitehat. I am the project evaluator. I want to thank you and let you know that this webinar will be recorded for future use. We presently have everyone in listen only mode, but we still ask that you put your phones on mute during the presentation and during the question and answer portion if you do not plan to ask a question. During that time, we will go into open mode so that if you do need to ask a question, we will have that available for you. We will hold the questions until the end, but feel free to type your questions in the box at any time. These slides will be available on our website, crcaiih.org, for future reference.
All right. Thanks, Emily. My name is Danielle Kenyon, and I'm the Program Director for CRCAIH, the Collaborative Research Center for American Indian Health, and I help the Principal Investigator, Dr. Amy Elliott, with the administration of the grant activities. I work with Emily on the project's evaluation and also head up the Pilot Grants Program Subcommittee. So for our second webinar, we wanted to highlight tips from our grant writing and grant reviewing experiences. So I'm really excited to talk with you today because often grant writing seems like this elusive, mysterious thing, but I tell my team members and students who want grant writing experience that there's no magic key or special training to prepare you for grant writing. The best experience you can get in grant writing is by actually jumping in and doing the writing itself. So by being a good writer and practicing writing in general, this skill will translate to writing winning grants. So if you're new to grants, the CRCAIH Pilot Grants opportunity is the perfect grant to get your feet wet with. So when I started this position over 5 years ago, I was very unfamiliar with grants in general, especially National Institutes of Health grants. And with all of the technical grant language and forms needed for NIH grants, but now it's just become second nature to me. And I know a lot of other people as they've gotten more experience. So I had lots and lots of support from our grants team, especially Rhonda and Tabitha in the Sanford Grants office. And luckily for the CRCAIH Pilot Grants process, they're available to you as well in putting together your application. So I cannot stress enough to please utilize their help. And you'll hear me say that a few times over this afternoon. So overviewing what we'll cover today, we'll talk about briefly what CRCAIH is and describe how the Pilot Grants program fits within CRCAIH. We'll talk about deadline considerations that you'll want to think about for the Pilot Grants opportunity and the importance of utilizing the CRCAIH resources that we had the webinar in last month. We will also detail specifics on the review process and scoring categories and go over the important pieces to really focus on when reading the RFA and application directions. The next part of the webinar will be to detail the different parts of the grant, specifically the parts of the research strategy, the importance of the specific aims page, how to address significance and innovation, and just your basic research approach. Good things to keep in mind when covering all of those pieces. Next, then, we'll talk about partnerships and the various writing considerations that you'll want to take into consideration, especially writing any grant, but particularly for the CRCAIH one. And then we'll detail some grantsmanship tips from the reviewer's perspective, and then wrap up with some budget recommendations, list of resources. And then we'll finally conclude with a question and answer period where you'll be able to ask any questions that you want on the CRCAIH Pilot Grants program. And as Emily said, you can type in questions as we go along, but we'll hold those until the end. So, as many of you already know, the Collaborative Research Center for American Indian Health was designed to create a platform for various different organizers and people to come together to where we're uniquely poised to address health disparities for American Indian health in North Dakota, South Dakota, and Minnesota. And really, we feel that CRCAIH is positioned to be a leader on the national stage in creating and defining this transdisciplinary approach to American Indian health. So the CRCAIH was designed to create this common ground to bring together people of multiple disciplines to work together to improve American Indian health. And this includes folks from tribal communities, healthcare organizations, and research investigators to come together in raising awareness for American Indian health disparities and in designing and implementing cutting-edge research that addresses these disparities. So there's two major ways that CRCAIH addresses health disparities through research. So again, our big focus is research for American Indian health. And the first way we do this is by building tribal infrastructure to do research and regulate that research that goes on at each tribal community. So currently with CRCAIH, we have 4 tribal partners throughout the North Dakota, South Dakota, Minnesota region. They're Ogallala Sioux Tribe, Cheyenne River Sioux Tribe, Turtle Mountain Band of Chippewa, and Fond du Lac Band of Lake Superior Chippewa. So with these partners, we're focusing on activities such as building community engagement in research and basic knowledge in research, improving awareness of the research that's going on in their communities, as well as building up their tribal research regulation, such as through research review boards. So the second major overarching activity of CRCAIH is the support of solid research on social determinants of health in American Indian health in North Dakota, South Dakota, and Minnesota. So we do that, as you see from the pyramid, through the support of 3 large research projects in the research division, which are led by research leaders in our region. And these projects focus on the topics of pediatric asthma, kidney donation education, and pediatric emergency room utilization. And all of these projects are making major strides in year 2. So this research activity houses the pilot grants program mechanism that we're focusing on today, so that CRCAIH isn't just supporting seasoned investigators, but that this pilot grant mechanism is really focused on those junior investigators and investing in the future of research in American Indian health in our region. So what's really wonderful about CRCAIH is that we have the resources, funding through NIH, to support these activities for new investigators. And through our divisions and corps that you see on the pyramid, that we can help build that expertise and skills of investigators like you. So what we're focusing on today is building up those writing skills of junior researchers and those that are new to research. So part of the mission of CRCAIH is to help support innovative ideas from folks who may not have that background in research but have a great idea and that will help services in American Indian health. So with support from the CRCAIH team and all of the activities that the corps and divisions can offer, we want to support you to be able to help put that research project into place. So again, these pilot projects are 1-year projects, rigorous research activities in a 1-year period of time. So for example, a lot of times if you're a new investigator or don't work in a big university, often people don't have an in-house statistician that you can go to and work with all of the time. Or maybe you don't know what human subjects paperwork is needed for a project that you're interested in. So these are just a couple of the ways that CRCAIH is poised to help people like you. So again, to briefly talk about the overall purpose of the pilot grants program, and for the purposes of this talk on pilot grant writing, I'll try to highlight the things that reviewers will be looking for in your proposal. So as I talk about purpose of the pilot grants program, you can see I bolded those keywords that you want to keep in mind when you're preparing your application. So for the first one, as I previously mentioned, a strength of our center of CRCAIH is this transdisciplinary focus. So what we want to see in the creation of pilot grant programs and projects is the creation of teams with people from multiple disciplines coming together to approach a problem and utilizing each other's expertise and experience in their field and their perspective and building from everybody's unique perspective to create a new approach that is unique. So as we all know, American health issues are complicated, so they require a multifaceted approach, and where clinical and interventions are very important to the practice of health as well as research. So this collaborative transdisciplinary team is a strong focus of the review scoring, especially considering how all of the partners of the research team are committed to the project, as well as that connection with the community that you're working with. So the projects that we're looking for will also embrace a social determinants of health focus in looking at a health condition. So this would include pretty much any type of research outside of basic sciences, if you look at it the right way. So research that wouldn't fit is just looking at a genetic mechanism or genetic predisposition to disease. But social determinants of health, which has become a big focus recently, it includes research on individual and community behaviors, as well as social conditions, including economic factors, SES, socio-political conditions, broader environmental and cultural factors. And then lastly, what the reviewers want to see, and what we see the purpose of the pilot grants program is for the opportunity for organizations and investigators to get that pilot data for research questions they have and utilize that data that you're able to collect in our pilot grant mechanism and apply for future funding mechanisms. So that will be important to address in your application. We also would like to see the case for research knowledge being gained, and how do you see the data that you will be collecting in this project help drive what we know about American Indian health forward in the research literature. So again, a strong focus in making a case on how can this impact not only the field, but how will this be an investment in your future as a new investigator. So I'm sure most of you have been on the website CRCAIH.org/pilotgrants, where we house the requests for applications that are referred to as RFA, and the application, which is a Word document. And we've been trying to get the word out and have sent this information throughout the region to well over 600 contacts in tribal health organizations, academic grant offices, tribal leadership, as well as at Sanford and other organizations we work with. So, and I know many of you have already looked at these, and I know these documents can be intimidating at first, but I can't stress enough how important it is to read and reread and reread the RFA. So usually at the time of submitting a grant, my copy of an RFA is really ragged because I've made so many notes and highlights and sticky notes well within, and it becomes quite a keepsake. So recently I've been trying to go paperless, and these are always good mementos of the progress that you make throughout preparing a grant application. And recently found the RFA that we had in for the grant and applying for the CRCA grant. So it totally made my day. So just the importance of rereading and making notes all over the RFA is really important. So in developing the RFA and application with our grants office, we tried to make the information as clear and approachable to new investigators as possible, while still including that detail that the National Institutes of Health want for their review. So all of the pieces in there are needed review for not only ourselves but our funder at NIH. So the key to not forgetting any pieces of the application is using the application document, because it's a fillable Word document that we've tried to make very user-friendly. So if you haven't already, start reading and making notes in the RFA and application, and reaching out back to us where you have questions. So the next webinar that we'll be planning to hold at the end of the month is hosted by the Sanford Grants Office team, and it will focus more specifically on the forms, filling out the forms, and the specifics of things like the budget, the bio sketch, and those pieces. So Since they'll be doing more of that grant technical assistance, the focus on today's webinar is more on the pros in preparing the grant proposal. So as always, just a reminder of our timelines. We were really excited to release the RFA back in November because we were addressing feedback from last year's applicants that they wanted more time, and we also made the deadline earlier than last year so that the awardees would have more time on the back end to obtain human subjects and IRB approvals, as well as more time for NIH approvals before the start date on August 1st. So we were really excited to release that grant information almost 4 months, giving people almost 4 months to prepare their applications. So the next deadline that's coming up is the letter of intent that's due, and that's pretty basic information that is recommended, so not required. It gives us an idea of how many applications we're going to have so that we can have enough reviewers in place, have enough reviewer expertise in place in case there's a particular topic that we can find a good match with. And then the big deadline of February 24th, which I hope is already on your calendar in big red letters, is, and our deadline is 5 o'clock Central Standard Time. And the Central Standard Time is, of course, important because we cover 2 different time zones in our, just the 3-state area that we're covering. So, and this was really important because last time the application missed the deadline for review, so I know the grants office is very serious about this rule. So even though personally my heart hurts a little at the idea of not sending our applications out for review and having to turn people away, they assure me it's for the greater good of holding everyone to the same standards and being fair, that we're not showing favoritism and holding people to the same standards that NIH would. So a lot of this pilot grants program process that we talk about the greater goals, what we want from it, are preparing new investigators for NIH funding mechanisms. So we feel like if you apply for our CRCA pilot grant, you're learning many of the standards and skills and pieces that you will need to apply for federal funding. So this points back again to our overall CRCA goal of increasing tribal infrastructure to do research, because we hope we get a many number of applications from tribal organizations, but will hopefully increase the amount of research for years to come focused on social determinants of health among American Indians in our region. So again, with the big deadlines coming up, probably faster than we can imagine, the Sanford Grant Office triage will take about a week. We have an external review committee that is made up of people from across the country and in Canada, and we do a telephone review. And we're setting aside probably about a month for them to do the review and hold the review call. And then those funding decisions will come back looking at budget of different projects and come back to our subcommittee for final decisions. And at that point, we're thinking probably mid-April that we will have our folks chosen and send them information that we will be requesting that just in time additional documentation so that we can send materials out to NIH for review. And then once we get the final go-ahead from them and all budgets look good, project recommendations have been taken into consideration, funding will begin on August 1st, 2014. So as I just mentioned, we didn't accept one of the applications from a deadline that came in after a deadline last year, so I cannot stress how important deadlines are. So oftentimes, as many of you folks who have written grants before, obtaining letters of support and recommendation is one of the hardest parts of writing a grant. So many times this year, our letters of recommendation are now required to demonstrate partner commitment to the pilot grant and the project. So you need to take into consideration that often your partner's number one focus is not research. And this is getting a letter of support to you while they may find the project really important and be super interested. It's, might be one more thing on their overflowing plate. So last year, folks ran into this problem because we had a big blizzard, imagine that, that affected people being out of the office. So given that our deadline is even earlier in the winter season, odds are this will come up again as an issue. So keep that in mind. Be requesting those letters of recommendation early and following up often. So the second point I wanted to make is leaving plenty of time to obtain signatures from your institutional officials. So speaking of busy people, these folks at your institution are often some of the busiest people in your organization, often lots of travel. So this is one of the important signatures you need on the second page of the application. And if you have questions about who that would be for your organization, please contact our grants office. So I know for us at Sanford Research, it's usually our VP of Research who signs off on this. So another point that's worth mentioning is the institutional grants offices, often called sponsored projects at universities. So sometimes they have deadlines, internal deadlines, that all of the pieces of the grant need to be to them sometimes a week ahead of when the grant is actually due to the organization. So please contact your grants offices if you have them and factor those into your timeline. And then another thing to consider, not as important for this mechanism, but as our grants office will attest, you always have to plan for technology issues and glitches, and nowadays many of the grants require uploading on websites such as grant.org. So for CRCA, the submission is by email, that your whole application needs to be turned into a PDF and your prose sent as a Word documentation. But it needs to be emailed to our grants office. So keeping that in mind, emails go down, those types of things. Please don't wait until the last minute. Another thing worth mentioning is being aware of formatting issues that may come up as you cut and paste and put your prose into the application. This actually came up last year as well, so it's good to double check everything before you submit your application. And again, if it's not already in your calendars and marked in red, February 24th at 5 o'clock Central Standard Time. As I mentioned before, what's unique about CRCA is the resources that we have to offer. And I know many of you were able to join us for the last webinar in December, which focused on these resources from the cores and divisions. So for greater detail, please see our website for the whole presentation. And we're working on posting the slides with audio, so we hope to get that up soon. But just as a quick overview of those pieces of the triangle, if you remember that is in the bottom right-hand corner, the administrative division, a lot of what we do with pilot grant applications is talk with them about eligibility of the program staff, the fit of the proposal idea, helping them talk through the design of your study, and we can also help assist with the evaluation and measurement. So those are really fun conversations with brainstorming different ideas and helping tailor people's ideas to fit our pilot grant mechanism. The Community Engagement and Innovation Division, for those of you who have experience with research, but maybe less so with American Indian communities, may want to talk to the Community Engagement and Innovation Division. They are very helpful with assistance on general information and knowledge about potential tribal partners and organizations, have feedback about how to best engage the community in research, and those folks will provide a good litmus test for your project idea and be able to provide, okay, what tribal community organizations may be interested in your idea, or how you might want to tweak some things. The regulatory knowledge core is really important for everyone, even those with previous institutional review board experience may want to consult with regulatory knowledge because every project is different. So much of this consultation with regulatory knowledge core may happen after the award, but specifically for this proposal, there's a section where you need to detail how you will protect your human subjects, including specific sections on how you will protect women, minorities, and children, and also filling out the planned enrollment table, which last time many people had trouble with. So they are happy to review ideas for these sections and do things such as consult on which IRBs would need to review your material. So, and often that may seem straightforward, but often is not. The methodology core, again, like I had said, oftentimes people don't have a statistician close by that they get to consult with, so they are happy to talk with you about the design of your project, perform power analyses, talk about different measurement tools, different types of analyses you may want to consider, and also different options for data storage. So everything data, methodology core would be happy to talk with you about. And the culture science and bioethics core is really our core that provides expertise on American Indian cultural perspectives on research, including how you should best plan to observe cultural protocols in your research design. They can help give advice on feasibility of working with American Indian communities and how to best approach them in doing research. And then finally, as I've mentioned, the Sanford Grants Office is there to help you with the more details and all of those questions about filling out the forms. So we encourage you to contact them now to get on their radar that you'll be submitting, get any help with budgeting and those types of things. All right. So again, stressing that we're excited to work with you and assist on the grant, but to please contact these individual cores early, as in last year. We expect it to get pretty hectic towards the deadline. So for the CRCAIH pilot grant, our scoring categories closely mirror NIH's, but are slightly different. So when you're preparing your application, please consider that these are the categories that reviewers are looking for. So oftentimes I will start a word bank of important words or things that I make sure that I want to include in the grant application. So purpose, priorities, and significance is a big category comprising of 25% of the score. So this is the reviewers are going to consider the relevance of your research project to advancing the scope of the CRCAIH, which I talked about earlier, that focus on transdisciplinary social determinants of health and American Indian health in our region. The second piece, the scientific approach, comprises 30%, and this is where the reviewers consider if the proposal is within scope of can this be done in a year, is your rationale based on solid scientific methodology, and do you have an effective plan for meeting your objectives. The next category is that innovation and potential for future funding that we feel is so important for new investigators, which comprises 15% of the score. So this is where seeing if the project is innovative and has the potential to lead to either federal, state, or private funding, and how do you see supporting the sustainability and growth of the project. The investigators and environment are 15% of the score. And this is where reviewers will look at how does the project, will it effectively use the requested resources and budget and use the grant funds wisely. So they will look at if the proposal and research team has adequate support, personnel support, and what is the likelihood of success due to the project staff, their capabilities and criteria. This is where they'll look at facilities and equipment and any budget resources and things that are coming from other sources. And then the last category, which is new this year, is the collaborative relationships, which will comprise of 15%. This is where the reviewers will consider how the proposal is meeting the principles of community-based participatory research or tribal participatory research. So we want to see a thorough commitment of all partners involved, and that there is a demonstrated community support for this research. So again, our letters of support are mandatory from partners. If there's any letters of support or MOUs to help support your project, that will strengthen this category. So, in diving into the actual application, again, reading over all the forms and noting where you would need further clarification or need assistance. So, for example, if this is the first time filling out the planned enrollment table for your project, this might be where you get additional help ahead of time. Looking at all of the formatting requirements, they're on the RFA on page 5. So those little things like picking the right font, making sure it's big enough, those types of details. So like NIH, as I warned, our grants office will throw out applications that don't follow these guidelines. And I also wanted to highlight how important it is not to ignore the supplemental documents when spending time on your research plan. So obviously most of the time will be spent focusing on your grant pros, but things like the abstract, like the biographical sketches, the facilities, all of those things will factor into your score. So a few years ago, there was a change on the bio sketch that now there's a personal statement at the top where you can demonstrate you and your team's expertise. So those are the things that will be looked at to see how they and will factor into that environment and collaborator score. Another important section is that during the review this year, we're going to have a special section at the bottom of the form for reviewers to check if the human subjects plan is acceptable and if they have suggestions. So much like NIH review. So again, the research strategy is the main part of the application that you want to spend the bulk of your time preparing. So the research strategy section is up to 6 pages, and that specific aims page is up to 1 page. So usually it's the first page of your research strategy, and then after that we'll look at significance, innovation, and approach. So that first page, which I'll talk about right now, is that specific aims page. So the aims are also known as research questions or hypotheses. And the aims page is very, very important because that's a snapshot of what your overall grant is on 1 page. So the information there is kind of whittled down from the rest of those 6 pages. So what you want to show in that specific aims page is that you know the research literature, but where there's holes that can be expanded upon. You need to show where the most promising research needs are and where are the opportunities in your field that you can improve upon. So the specific aims themselves, again, are the research questions or hypotheses where you want to write those clear goals or objectives that can be obtained in a 1-year project. So what we would recommend for a 1-year project is probably 2 or 3 strong aims that you can get accomplished. So making sure that you don't overreach what you'll actually be able to do. So again, when you're looking at yourself and an investigator and trying to put together a package, looking at where do you have the best skills to make an impact on your field, and looking at the other players in your field and judging whether you can compete in that topic area. Another strong thing to keep into consideration with the specific aims pages is not to write those aims so that they rely on results from other aims. So let's say your first aim is to collect data on a certain topic, but let's say for some reason you weren't able to accomplish that aim, or you didn't find the results that you had expected for specific aim 2. So although the aims often come in sequential from one another, making sure that they don't rely on each other. So I wanted to include, although you probably can't read the detail of these are wanted to include a couple of the specific aim page snapshots from our previously awarded grants, which were just amazing grants, just to highlight how the specific aim page flows and that you can see where the importance of formatting. So these examples have white space built within. They have bold for the sentences they really want to highlight. And they've got those specific aims highlighted in the middle of the page in bold, and then some supplement explanation after them. So this is one example, and then this is another example. So what this group did is they included white space as well, but they used more underlining than bold. So because the specific aims page does have a flow and a rhythm to it, I thought that would be important just to show a couple of examples of how to do that. So for the significance and innovation sections, what we found in grant reviewing is that people really do well in significance, but that they usually lose points in innovation. So significance, what you want to do for the CRCAIH pilot grant is focus on that social determinants of health for American Indians in North Dakota, South Dakota, and Minnesota. So again, how in the content area that you're focusing on, how does that help with reduction of health disparities? How does it help improve scientific knowledge? So what you're looking at, and the question you need to ask yourself is, if the aims of the project are achieved, does it matter to anybody else but the principal investigator? So how is it going to impact people in general, and does it help impact health at a broader level? So again, a lot of times people do really well because our health disparities are so needed that the significance is really easy to show how important the question is, but it's that innovation that's a lot tougher to write to. But this is where you can challenge yourself to describe novel theories or approaches. What are some unique instruments or methods that you're going to be using? What is really the improvement in scientific knowledge that you're going to be asking? So again, it's not enough to say this work hasn't been done in American Indian populations, but why is it important and how will it drive the field forward? So the scientific approach, that was, again, the strategy is 30% of the score, so it's the largest proportion of the score. That the main idea that our PI, Amy Elliott, always says is the first thing that you've got to have is that good idea. That good idea that can be modified and tweaked, and that will really drive what is your approach, and that you have that solid rationale for methodology and activities. So one thing that I usually start with when I'm outlining what a project's design should be is to draft a timeline of your activities and organize it by aim. That helps organize and think about, okay, what activities need to happen at this time, and especially for a one-year project, you're going to need to have a good, clear sense of that. One important thing that reviewers like to see is consideration of alternative hypotheses, and including a section of text on potential problems that you may anticipate and how you will address them. So reviewers like to see that you've thoughtfully considered the barriers to your project, knowing that things will come up, and that you've thought about how you will overcome these. So again, this is where your methods are being outlined, and we are happy here at CRCAIH in admin or methodology, or any of us, happy to bounce ideas off of us. So I love these cards, these e-cards, for their snarky insights, and of course this plays on the funny childhood saying that you all remember of liar, liar, pants on fire. But I thought, of course, like, no one in research wants to be known as a liar or misrepresenting your findings or results. And I thought this one was good, a little lighthearted, to highlight the importance of picking the right study design. So if focus groups, is that really what you want to do? It's not the right appropriate method if you want to make statistical inferences where you would need numbers. So just think, especially for these CRCAIH pilot grants, you're not alone as a principal investigator, that you can talk with one of us, and please reach out and make sure your grant doesn't make it all the way to the review with a fatal flaw, such as trying to use focus group data to make statistical inferences. So the next big part of the scoring and section of your grant is the investigators and environment and collaboration. So one of the frequently asked questions that we had last time and that I get is, does the principal investigator need to be a PhD level person, trained person, or should a tribal partner be the lead? And that's a really hard question to answer because there's no right answer. What I think you need to focus on with your project is building that strong transdisciplinary team. And who is really going to be driving the conducting and oversight of the whole project. So you're going to want to look at building a balance of expertise in that research content area, along with what is that real world experience with working with the population, or if you're doing something that's more intervention, clinical focused. You'll want to look at which research methodologies and have expertise in that, and building upon your established relationships. So as we've mentioned, letters of support are required, and you'll want to consider how your team's expertise fits the research question and design of the project, and how do you build the strongest team possible. So again, under the guise of please start writing early and utilizing your colleagues and mentors to the fullest capacity is to, one reference I found said to send out a review of the first draft of your specific aims of your proposal early, about 6 weeks or so. So we're pushing that timeline about right now. We're at 6 weeks, so the sooner the better when your team can start hitting the writing hard. So another resource I found, I loved the quote, "Write to excite." So a lot of these tips seem like common sense, but when you look at successful grants, these writing points may come down to the ones that make a difference in whether your project gets funded or not. So one big lesson I learned from my graduate mentor was this first point of organization of ideas. So I was just reviewing a paper today that I felt made this error, that it really makes a difference in reviewers' ease of reading. So if you order your ideas and content the same way throughout your proposal, that's going to really help the reader and in turn make your reviewers happier. So if you can order your ideas the same way throughout, the same variables in the same order on your specific aims page as you would in the strategy, as you would in the tables or appendix, the happier the reviewers will be. So you'll want to try to be succinct, with 6 pages. You only have a finite amount of space, and you'll want to make clear points. So at least one main point in each paragraph that you build the rest of that paragraph around. What you'll want to do is use language in a way that an educated non-expert can understand. So even at NIH grant reviews, there's not experts there in your content area only. There's going to be people outside of your field that are reading these proposals. So please stay away from any jargon and clearly define the terms that you're using. So other things that help in organization, of course, are use of headers for each section, using subheaders. A lot of times I like to use those scoring categories as definitely bigger headings and subsections. To keep it exciting, again, trying to be exciting, use diagrams when you can. Use figures and tables, but make sure that your tables aren't at the 0.6 font so that your reviewers are trying to squint and read. That gets pretty frustrating. But so just some tips to helping think through how do you make it pleasing to the eye is always appreciated. So another way to do that is including some white space like you saw in the specific aims examples. Another thing to emphasize your point and get the reviewers excited is to emphasize certain text with italics, bold, using bullet points. Formatting really matters to the clarity of your proposal. Another point is using an active voice. So you can actually look at a Microsoft Word function that will run the percentage of your passive voice. That's kind of actually fun to use. And this was a recent critique of one of my papers. So we ran the document line by line. And this is actually very helpful. You probably won't have to do that to get to that crazy level, but It is actually very helpful because it changes the tone of your document. So in talking with my team members, this tone is really different. So if some of you are trained academics, we're taught to be very cautious about interpreting our findings, very careful not to overstate our analyses and results, and the tone of writing comes off more wishy-washy. But what's exciting about grant writing is, as our director Amy says, this is the only time that your world is perfect and this project is going perfectly when you're writing a grant. So you can feel free to be fairly strong-worded and say, we expect this to happen, this is what's going to happen. So it's actually a little more fun than manuscript writing in that respect. And then lastly, watching the overuse of acronyms. This was a real pet peeve of one of my former mentors who's done a lot of grant reviewing at the federal level, so I always keep this in the back of my mind, writing for any audience actually. So basically, assume that your reviewers are exhausted, they're overworked, they've been reviewing tons of applications, they have very little patience, so you want to make reading the grant the most pleasant and exciting experience for them that you can. So if you can get the reviewers excited about your study and have that team in place to back up your plans, you've got a great design, you're on your way to a very good grant score. So in preparing for this talk, it was really fun to go through all of last year's grant reviews and look at and pull out what were the commonly cited reviewer problems that our grantees from last year came across. So on the first category of purpose and priorities and significance, some people got dinged because relevant literature was not included, so making sure your literature is always up to date. Another thing under this category was lacking detail in connection to that social determinants of health piece. So another comment was, why would you be proposing to utilize American Indians, which are a hard to reach population, that it should really be benefiting American Indian health in the region, that it's not just good enough to say, well, it hasn't been done before, but how is it really going to directly benefit American Indians in our region and have implications for health? So if you can, it always looks good to include local statistics or statistics that are focused on the content area that you're focusing on. So in terms of the scientific approach section, some of the things that we had discussed earlier, what's important to take into consideration is some folks had an overambitious research plan. So again, it's really exciting as a researcher to design something when you get carried away and your project becomes this big. Unfortunately, in a year pilot project, you do have to whittle it down and be fairly focused. So, and that was the next one, that the aims lack focus. Another one was that rationale for the methods wasn't described. They always wanted more detail in that analysis plan, and that's where, if that's not your strong point, please feel free to reach out to the methodology core. Another thing that's tough with a pilot project is the ability to get a big enough sample. So, and to make sure that your analyses match what your proposed analyses are. So another consideration with this is reviewers pointed out that important variables weren't included for measurement in the analysis plan. So a lot of times we know there's confounding factors that are out there, but how are you going to account for that in your proposal? There were concerns if sensitive data would be handled properly. So again, going back to the importance of your human subjects documentation. Another piece on lacking detail on participant and advisory board recruitment, and including preliminary numbers of potential participants would be good. Again, on the last categories where reviewers commonly had problems, that potential for future funding is huge. What are those next steps for funding, and showing where is this pilot data going to take you in the future? Just saying that CVPR is innovative for American Indians did not cut it with last year's reviewers. So where are you going to build on from there? That's not the only innovative part for your study. There were other concerns about innovation, intervention, sustainability, and how can this sample be followed beyond the project period. Under investigators and environment, some things to think about is choosing that percentage of effort for team members. Sometimes it was seen as too high, sometimes it was seen as not high enough. So finding that balance, and again, we'd be happy to talk through those things. Our grants office has lots of experience giving advice on that. And again, the background of the team is very important to showing that you can carry out this research. And again, under collaborations, how important this is, we can't stress enough. So your projects need to have involvement from folks in all across all different types of organizations, so that there's no involvement from American Indian professionals or community members was seen as a problem. That if your data and data collection or analyses relies on another organization or providers that have a large part in collecting that data, if they don't have a letter of support, that is seen as a red flag for reviewers. And then again, if there's no existing relationships discussing that does take a lot of time to build, and community-based participatory research does take a lot of input and time to build. And finally, some budget recommendations to, again, reading over all the forms, including the budget, noting where there's further clarification or assistance is needed. Our budget form, a couple of the tables have shifted a little bit from last year, so if you applied last year, there's been a little change to try to help clarify number of months for personnel and those sorts of things. Think about what is the pertinent percentage effort for team members. Maybe you want to consider in-kind effort because this is a one-year grant. How do you clearly define people's roles in that budget justification and in the text? Another thing on budget to consider is that the respondent burden should match the incentive. And again, we can help you if you've never written that before to help think through those. Is the $40 gift card appropriate for doing a 1-hour survey or those types of questions? And then travel should be judiciously planned. With this pilot grant, you don't want half of your budget to be in travel. And this year we want you to include travel to our annual summit. So including some of those funds for that. So again, I've included some resources to help you think about and how to approach writing your grants, your pilot grants, and used a lot of these resources to prepare these slides today. Want to give a big thank you to all of those people that go into CRCA. As you know, it takes many of us, as you can see here, and a special shout out to those of you who submitted proposals last time. We had a very competitive application last time, and I want to implore you to look at the feedback you got from the reviewers last time and think about modifying your project. So as I mentioned, I've been recently cleaning out my file cabinets, and it was a great reminder to me to find all of those grant rejections that I had over the past many years. So even applications I forgot I submitted to foundations and every mechanism I could think of. But just kind of reminding you, being a researcher or working as part of a nonprofit is developing that thick skin for feedback and always trying to make your project better the next time. So one thing we always like to say is that none of the time you spend preparing a grant application is wasted, that it's really an investment in your future, and you'll always use that writing somewhere.
Great, thank you, Danielle, for that overview of the pilot grant application process. We are now going to have a question and answer period. Please remember to mute your line if you are not asking a question. Also remember to add to your calendar that the next Pilot Grants webinar, Pre-Application Technical Assistance, will be on January 21st at 2 o'clock p.m. Central Time. The application again will be due on February 24th, 2014 at 5 o'clock p.m. Central Standard Time. We are going to start with the questions. We've received one question online, and after we answer this question, if you have any questions that you would like to ask over the phone, we will be happy to answer those. So again, we're excited to assist you in this effort, and please remember to start asking questions now. The earlier the better.
Do you want to read the question?
So our first question is, what type of individuals and entities are in the pool of competitors?
All right. That's a very good question. So, it's as broad. We don't have any stipulation about that there's a certain type of organization or entity that needs to be involved. That being said, every organization that receives money needs to be eligible to receive federal funding. So there are certain stipulations on that. How I like to look at that question is, again, that I started talking about is, well, who should be the lead on a project? Should it be a tribal organization? Should it be a nonprofit organization? Should it be an academic organization? And we don't have any stipulations on the certain degree that somebody needs to have. We like to think that we have a fairly open mind about that it doesn't necessarily need to be a PhD in a lead on an application. That being said, we never know what type of pool that we're going to get applications from. And last year's pool was very competitive, that we received 25 applications that we sent out for review. And they were wonderful applications. And we chose to fund 5 across these last couple of years, last year and a half. And they were all PhD level people that were in the principal investigator role. So that does not mean that that's going to be the same level of competitiveness, or that that it needs to be a PI coming with a PhD. But again, focusing on getting that well-rounded grants team. We are very excited about the great number of interest we've had so far, and the amount of you that have attended these webinars. So we are really excited and hope that we have another great competitive year.
Great. We'll go ahead and see if we have any questions from our listeners online here. If you have a question and you want to unmute your phone.
Right. Any questions from anyone in the remaining few minutes that would be helpful for everyone to hear the answer? Great. Good.
Well, if you have any questions, please feel free to email us at info@crcaih.org, info@CRCAIH.org. Our call 605-312-6232. And again, remember the applications are due on February 24th, 2014 at 5 o'clock p.m. Central Standard Time. And our next Pilot Grants webinar will be on January 21st at 2 o'clock p.m. Central Standard Time, and that will be with our grants office. Thank you for attending our webinar today. We appreciate your participation, and the slides will be posted on our website in the next few days.